welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Sarita Nayak. Before I introduce her, I must confess that as part of our 200 plus sessions that we've had, I must confess that we have not given due justice to gynecological issues, though we've had a few gynecologists as part of our sessions, but the fact is that we've not done enough justice to the subject. So today we have Dr. Sarita Nayak, who's a specialist urogynecologist who deals with women's urinary and menopausal issues. She's a gold medalist from Delhi, trained in urogynecology from Singapore, and is now settled in Mumbai. With 18 years of extensive experience in her field, she believes that medicine and surgery can treat a patient, but compassion truly heals. Dr. Sarita Nayak is associated with the Hinduja Hospital in Mumbai, as well as a few of other hospitals, and has her own clinic in suburban Mumbai. Over to you, Dr. Sarita, for this session. Thank you for coming here. How have you been?
I'm all good. Thank you very much for inviting me. I think it's a pleasure. It's nice to be here, and definitely I'm looking forward to this interaction.
Yeah. So, as always, we've requested Dr. Nayak Dr. Sarita Nayak to make a presentation here. Please do watch it. Remember that this presentation will be recorded. This entire session is being recorded, so you don't have to take notes just now. And if you have any questions, please ask them after the chat in the chat window. Do mention your age or the patient's age so that Dr. Nayak can give a considered reply. Over to you, doctor, and we'll come back with a Q&A later.
Thank you. I will be sharing my screen.
Yeah, please go ahead.
My presentation. Okay, I hope it's visible and audible. Interrupt me in case if it gets
disturbed.
Yeah,
it is absolutely visible. Thank you.
Good evening, everyone. Thank you for having me here. So, I am Dr. Sarita Naik, and my whole specialty revolves around women and especially urinary, menopausal, and sexual issues of women. Now, since I'm invited here to talk to an audience who belongs to more of a senior citizen space, now let me say we always say age is just a number. But let me also say, yes, it's just a number, but it does bring a lot of other things with it. So here I am today going to talk about certain things which are sensitive for a woman who has, let us say, crossed age of menopause, is postmenopausal, perimenopausal, post 50 years. And these are the complaints which women do not talk freely about. They have their hesitations, they are reluctant, the facilities are not there, and in busy clinics the doctors also sometimes are so busy that they may not be able to give you due attention which you might be seeking. So use this opportunity today, ask me questions, let's try to have an interaction wherever it is possible, and try to understand what can bother a lady after 50 once she has attained menopause, and how urinary symptoms can really affect even the mental well-being. So I'll start with some questions. Let me ask you, do you ever leak urine while coughing, sneezing, laughing, jogging, trying to do exercise, walking, bending down? If answer is yes, please make a mark. Have a small pen paper with you or just in your mind. Just mark. If the answer is yes, then you are at right place today. Do you need to go toilet for passing urine many times a day? It's like just now you had gone, you just sat down, settled in your seat to want to watch something on TV, and suddenly you want that you need to go again. If the answer is yes, yes, you are at right place today to get answer to your queries. Do you rush to toilet very urgently once you need to go? Means if the alarm clock rings in your mind, you have to go, means you have to go. You will interrupt your, let us say, prayers, sitting in a meeting, maybe you're at a party. You just need to rush and you have to break that conversation, and you just cannot hold. Then again you are in right place today to discuss your woes. Do you leak urine before reaching toilet while rushing? Means often we know that there's a small amount of trickle which has happened, though our women wear very friendly, garments like our saris, our nighties, our dresses. They help us to hide that small leak, but actually it does bother us because we know inside that there has been a little leakage. Is it happening to you? Please make a mark, point it down. Do you feel any lump or swelling coming out from your private parts? Often women are not able to define it, but they are feeling something lumpy below. There's something like a ping pong ball, and they don't understand what is it. And out of hesitation, they are not able to even speak about it. And that's where my speciality comes in. So if the answer is yes, then you are in right place today. Let's talk about it. Do you keep getting UTIs? Let me tell you, my 70% practice in my clinic revolves around repeated urinary tract infections in women. Not even once in a year, there are multiple times when they have taken antibiotics. There's constant burning, there's a constant discomfort, constant rushing to washroom. Many times patients get fed up after taking antibiotics. Are you one of those? Please mark it today. You may get your answers today. Does any of above bothers you and affecting you badly? Somewhere your mind constantly is revolving around urination, around toilets. You have stopped going out because washrooms are not available. Then somewhere you need help. Somewhere I'm there. I can give you some awareness, and maybe we can interact and find out answers to your questions. Now, I'll start with repeated UTIs. Like I said, 70% of my clinic workload is dealing with urinary infections. And many times, women are not even able to define that what exactly is bothering them. Is it problem in urine area, or is it the problem in the vagina, because both are so close to each other. So let me first put, how will you recognize whether you have got a urinary infection? There will be frequency that you keep going to washroom. There's a sensation of urgency. You want to rush every 10 minutes, 15 minutes, half an hour. You have just peed, and then when you come back, you again feel like going, and there's hardly anything which is coming out. Is a typical scenario of a urinary tract infection. There will be pain while passing urination, burning sensation. Sometimes you can't hold urine, and that's called incontinence. And quite often, there can be some visible blood in urine, smell in urine, foggy urine, which is not very clean, and you feel a discomfort in your lower tummy and a feverish feeling with chills and rigors. Now, this scenario is where the infection is sort of increasing, and your body is telling that please go and find help. Let's understand why women in general have more chances of UTI. It is scientifically proven that over a lifetime, a woman can catch UTI at least 3 or 5 times more commonly than a man. Why? Because our urine area is small, it's short, while a male urinary tract or a urine pipe is much longer. The female urine pipe is very close to vagina, and therefore the vaginal secretions, the periods, the secretions below, they can always contaminate. The proximity to the anus is so much there. This whole area is hardly 5 centimeters, and within that tiny space everything is contaminated. So yes, in urinary infections are very common in those people who have, let us say, constipation, also in those people who have fecal contamination, or let us say they cannot control their motion, or those who have persistent vaginal discharge. They make a patient very high risk to keep getting repeated UTIs, and therefore I need to ask all these questions. Ask yourself today whether you have any of such situations with you, and therefore is that the reason of your UTI? Many times, senior women, they will put diapers or panty liners or pads just for the safety, but that particular pad or diaper itself may generate a lot of contamination and can cause repeated urinary infections. Now, once in a while, every woman can get a UTI, but repeated UTIs means more than 3 times in last 6 months is something which is really bothersome, and it is important for us to investigate the cause. In such cases, we really suggest you to come and see us. We need to check, a few things in your body. We need to do some sonographies. We need to do some urine tests, because blindly giving antibiotics is going to make it worse. Now, how do you deal with the UTI on your own? Simple advice: if you feel a discomfort below while urination, start drinking more water. You start with 6 to 8 glasses in a day, make it 8 to 10 glasses. If you are not drinking at all, definitely you increase the amount of water. Also, sometimes home remedies like coconut water, barley water, soda water, people try all these. Now, these two things people do on their own, but if it is not helping, There are certain simple things which I advise women in general, that at your age, after 50 plus, keep it handy till you actually get access to a doctor. What can you keep at your home which can help you at least in these tiny situations like you have gone out and used a public toilet. Let us say you did not like a public toilet, you held back, you did not pee there, and you hold your urine for almost, let us say, 3 4 hours. Or your work is like that, that when you are out in the sun in a dry humid atmosphere for long hours, or field work where you don't get access to a washroom, and by the time you come back you know that you've got a UTI. In such situations, it is good to keep at least some few remedies at home. These are simple things available in market in your chemist store. Citro soda sachets, cetal syrup, alkazol. They're simple urine alkalizers, and they alkalinize the urine and they can help you instantly. Now, what I don't recommend is taking antibiotics on your own. It is very common that your medical store person will give you straightforward a strip of Ciplox, Norflox, Neptaz, Monourol, and will just tell you, okay, this is good for UTI, go and take it. And this is where I want that you should not do it on your own. You need a help, because if you take it unregulated, eventually there will be antibiotic resistance, and for sure after a point these antibiotics will not work. Many times we see that after taking 2 3 tablets, patients get better, they stop medication and they feel I'm fine. While if you take these intermittent courses, next time after 2 3 courses, the medicine will stop working totally. So what I suggest, that having an alkalizer with you is good, it is helpful, but having unregulated antibiotics in a UTI episode is not okay. In those cases, you need to see us, you need to get a urine routine and culture test, and we will definitely ask for a sonography, an ultrasound for your kidneys and bladder, where we can check what you can how much water you can hold, how much is your bladder capacity, how much you pass urine, and is there any retention or a residual urine which is the cause for your urinary infection. Now, one part is to treat, that definitely I want to get my patient out from a urinary infection zone. Means when you have caught the UTI, surely you will need a treatment. But what can we do to prevent it? Somebody who is diabetic, somebody who has low immunity, somebody who is very tender and fragile, the weight is not there, the nutrition is not good, and overall has a tendency to keep getting infections. The best is to maintain your water intake, and an average intake is 6 to 8 glasses of water a day. Now, I understand all of our patients come from good background and hygiene is generally quite good. What extra they can do? One thing is that cleaning from back to front should never be allowed. Back means, I'll show you a model. If you can see this particular model, and if you see and correlate it with the diagram, you know that there is a anus opening behind, you know there is a vaginal opening, and you know there is a urinary opening. Anything or any movement which brings bacteria from back to front is going to give a urinary tract infection. So while you go motion, you clean yourself or you use toilet papers or wipes, make sure the movement has to be front to back and through, front to back and through. Do not use a rubbing movement, because the anal bacteria will always contaminate the urine pipe and you will end up getting urinary infections. So, this is one important part of the hygiene which we don't understand unless explained, because most of the Western toilet seats have a water jet which you use from back to front and can really increase chances of infections. Those who are sexually active, definitely passing urine before and after sex is an important preventive measure. Many times, all these things also don't work. So, in these cases, you need a specialist who can actually give you some preventive medications to take away all the bacteria which are sticking in the bladder over a period of 3 months. So, if you have been experiencing repeated infections, please don't sit back. Repeated urinary infections can eventually damage your kidneys. It's important for you to see us, it's important for you to check yourself for diabetes, and sometimes in some cases we may ask you to do a endoscopy of the bladder, which we call a cystoscopy, so that we know that your bladder inside is not damaged. Now, these are important points for prevention of UTI. What about specifically for women? Now, all women after 50, once they have attained menopause, vagina becomes dry and drier over next few years. By the time they are 60, the vaginal health, it has become really poor. It has become shrunken, dried, very dehydrated, and because of that, the immunity to fight against bacteria is gone, and therefore there is always a high chance of UTI. For these cases, we give vaginal estrogen creams, comes by the name of Primarin. Now, since it's a hormonal cream, you cannot just buy on your own and start using it. You need examination, you need checkup with us, you need a proper planning of this cream. But once you apply this, you see a big difference in the vaginal symptoms. The dryness get better, the immunity gets better locally, and the bacteria will not be able to attack that area so frequently how it was happening in the past. So these are important measures which we as urogynecologists advocate. We want to see you if in case you are suffering from such symptoms, and do not ignore them. The second part, the second more common symptom, most common symptom which at this age women suffer from is urinary incontinence. By definition, incontinence is involuntary loss of urine. Means when you want to hold, you end up leaking urine, which you don't intend to. That is involuntary, and leakage can happen at any random time. And it eventually becomes not only a social issue, because definitely nobody wants to leak in the pants while in a social gathering, and at the same time it becomes a hygienic problem even if it is not visibly there. If even if you're next the person sitting next to you is not able to see whether you have leaked urine, but if a small amount of urine is leaked in the panties and has made the area wet, the hygiene becomes the issue. You know, you can feel the smell, you know you are wet below, and that area with friction can develop further infections. And eventually if you put the pads or panty liners, they further causes vaginal irritation. Overall, it starts affecting quality of life at this stage and really put a lot of social innovation. Sadly, in our country, because of lack of awareness, it is highly underreported. Women take it as a normal part of aging. We have been taught to live with it. We have very low expectation from any kind of treatment because we assume that these are normal changes with the age, or they can be there very commonly. But let me tell you, in last 10 years, a lot of advancement has happened. A lot of medications have come up. A lot of treatment modalities have come up, and there is no more a social stigma that talking about urinary health, vaginal health, and an old lady asking about urinary leakage, is there a taboo in it? It's our own hesitation, so that because of which we keep holding back. While all the treatments are really available, and you should approach your doctors, physicians, gynecs, and urogynecs to ask for help. One condition we call it, what we call is overactive bladder. Now, in this condition, there is such a strong urge that you just cannot hold, and you will keep rushing to toilet again and again and again and again, and there can be a significant urine leak. Very commonly, we hear from women that in the night time they wake up when they want to rush to the washroom, the whole urine keep trickling, and they get so scared because the sari is wet, or the nightie is wet, or the bed sheets are wet. They start putting rubber plastic sheets on the bed sheets, and they get so scared that they will stop going to somebody's house. Technically, it is defined as anyone who goes washroom more than 8 times in a day or more than 2 times in a night will qualify to be evaluated for overactive bladder. Have you ever heard these statements from your friends, colleagues, maybe those who have senior citizens in their home as their parents, mothers, sisters, wives, that, every now and then I need to pee. I keep just going to washroom. I search for the toilet first wherever I go. In the mall I have gone, and then first thing I want to is find out where is the toilet. I have stopped staying at relative place because I fear urine leak. I have stopped traveling by local trains because there is no toilet. I take a corner seat in the movie hall so that I can go out anytime to pee. I just can't hold as I rush and I leak every time. So, these are the things which we hear from our patients, and these are so common with women above 50 and 60 that it's my everyday job to deal with such statements. Most of the time they say that it feels like I'm running a marathon to the washroom. I want to be in the yoga room, but I'm always in the washroom, and people suffer silently. Another similar situation is labeled as stress urinary incontinence, when there is a leakage of urine on coughing, sneezing, laughing, any effort or exertion. Somebody tries to go to a gym or go to a yoga session, and the moment she bends or take a Surya Namaskar downward bending pose, there's suddenly a leak. And just because of that fear and embarrassment, the lady is not able to do any kind of fitness regimes or exercises. Maybe simple dancing. One of my patients who used to really love going out with her friend circle to comedy shows, and where everybody was laughing, she laughed and she ended up leaking urine, and she was so embarrassed that she could never go out again. So a lot of such instances we hear from our patients where urinary incontinence and leak has affected the quality of life so badly. The impact is tremendous. It's unsaid, it is unexpressed, but let me just tell you in what all situations and how it can really affect a woman's life. Somebody who is leaking urine is not able to control. There will be a limitation and cessation of physical activities. Like I said, no more, exercising, no more walks, no more going out. Poor exercise further worsens the control on blood pressure and diabetes. And once these things set in, it is so difficult to reverse the entire vicious cycle. Somebody who is rushing to washroom again and again in the night always has a high fall risk. It was surprising to see in my own practice that my 20% of referrals comes from orthopedician, where they have operated on somebody who had a fall in the bathroom, got a femur fracture, hip fracture. They have done a surgery, and when they ask the patient, "How did you fall in the washroom? What happened? What was the reason of the fall? Why did you fail?" So the reason was that the lady was rushing for passing urine and she lost the balance. And the source of that fall was a overactive bladder, where she was not able to hold the urine. So fall risk becomes high, bathroom visits become more, risk of fractures become more. People who start putting diapers, they start getting rashes, urinary infections, and vaginal infections. Forget about these. Because of these things, one of my patients stopped doing her favorite activity like gardening. She wanted to sit down, do the mobbing, and wanted to just do her gardening stuff, but she stopped doing because she says, the moment I bend down to, let us say, dig on the soil, she just leaks urine. So occupations suffer, hobbies suffer. More than that, sometimes the domestic and financial burden becomes too much, because once they start putting underwears, disposable diapers, pads, and they feel at this age also, when I don't need it for periods, this is more severe, that I spend more on diapers than actual my clothes. So it is actually real when it starts affecting the finances and the economy of the house. And most important of all, it causes a lot of guilt, depression, shame, and somewhere they start losing their dignity. Old people, when they feel they cannot control bladder at this age, the smell of the urine which is in the clothes, people won't sit next to them, small children of the house starts avoiding them, they start losing their self-esteem, and they reduce their social interactions. Overall, it impacts the mental health very significantly, especially for women when they cannot speak it up and they have no resources to go out and find the right solution for it. And one small thing which is very important, we assume that sex life after 60 is negligible and it's not important, while it's not true. I'll be very honest that 50 to 60% of my patients beyond 60, they are sexually active. It's just that we don't give them a safe space to talk about it. And many of them say that because of the repeated UTIs post intercourse, or because of the painful intimacy, because of the leakage problems, they avoid the sexual contact and intimacy with their partner. So I agree that age is just a number, but with age numbers, as the age numbers, the changes in the body does bring some limitations which can be handled very well if they are highlighted to us. So I really strongly urge all of you that if you have issues like this, please speak up, please connect with us, please put up your questions in the chat box so that I can answer them in the end. How do we handle all these things? Many times that general perceptions that drink more water, it helps in detoxing, it helps in flushing your system, is true for a certain age, but it's not applicable to senior citizens. We need to manage the water intake for a lady of more than 50, 60, or 70 based on her bladder capacity and based on her requirements. So we really work a lot on the lifestyle management and modifications based on individual. Avoiding food which is irritating, caffeine, tea, coffee, carbonated drinks, certain things which trigger their bladder irritation, smoking, alcohol. We try to work on those things so that a bladder is not very irritated and overactive, and the patient can learn to hold. And we teach a lot of pelvic floor exercises. Now, one very important question: that how much water is adequate? Everybody keeps talking, drink water, 8 glasses, 10 glasses, 2 liter. Oh, I drink so much, and still, I get a UTI. These are so many myths. There are so many misconceptions connected with water intake and over drinking of water, that we forget that human body has to keep everything in equilibrium. Our kidneys make urine constantly whether you drink water or no. If you keep bombarding more and more water, the kidneys overwork. In fact, you lose more of sodium potassium if you keep drinking endless water whole day. The urine will keep forming, and if your bladder does not have a capacity to hold, and if your pelvic floor muscles are very weak, you will not be able to hold. So, what is the right way to drink water? I teach patients to drink 2 liters water per day, especially someone who is beyond 60. Should keep it reasonably to around 2 liters, especially if they are all the day indoors. They are not doing any heavy workouts, they are not sweating too much. And I insist that you fix your bottles in the morning. The rule is that you keep your glass size to a small cup size. Let us say around 150 to 200 ml maximum. Ideal will be around 150 ml. So understand that 1 liter bottle of your a steel bottle or any distillery or whatever bottle you're using, if it is 1 liter, then you have to drink and finish it in at least 8 glasses. If I say 150 ml, 150 ml, so you have to understand that 10 glasses of 150 ml will give you 1.5 liter. That is good enough. But if you drink same water in one go, because there are people who wake up in the morning and they finish at least, two big glasses in the morning, which becomes 500 ml, and your bladder may not be able to even hold that. And that's why they keep rushing, and the weak bladder cannot control. So the right way is that fix your water to roughly 2 liters, including everything: tea, coffee, juices. Make your cup size and glass size to smallest possible, around 150 ml. Drink every hour so that you are hydrated throughout. And do not drink water in night at least 1 to 2 hours before you go to sleep. Let your bladder and kidney rest in night. Do not hydrate them too much in night, because night time the control mechanisms are weak. Your mind, your body is in a resting mode, while if the bladder gets full, it gives you a signal. You rush to washroom, you end up rushing because your muscles are weak, and you will eventually have a fall risk. Try not to drink in the night. Keep a sip just to keep your throat wet. That's it. The best indicator whether you're drinking okay or no is through your color of urine. If your color of urine is clear, you're drinking enough. If the color of urine is really dark, concentrated, it's not very clear, it's foggy, hazy, definitely you need a little more water. But talk to us, talk to doctor, get a urine test done. Do you actually have a UTI, and that's why it's not clear? While you might be drinking enough water already. No point over bombarding your system with too much water if your bladder cannot handle. One thing we teach is pelvic floor exercises. Now, there are plenty of videos available on YouTube, Instagram, media, how to do Kegels. It's very difficult to absorb from a video and an online platform how to do a Kegels. It is very simple to say that squeeze your buttocks, squeeze the anus inside, tighten the vaginal muscles, tighten the urinary area, and hold. But 50% of the patients, they cannot identify what exactly I'm talking. So for that, you need to come down to a clinic. You need to go to a trained person to understand how to do a squeeze exercise and how to identify the correct muscles. The more you do, better is the result. And sometimes we enroll a pelvic floor physiotherapist to teach our patients, take few sessions, learn properly, and then do it. Doing it wrongly will do worse. to your pelvic floor, your pelvic muscles. Your bladder control may get worse if you end up doing it reverse. If you start squeezing your abs, if you start holding the breath, you start squeezing and crunching down, like holding tight, and the leakage in the bladder will get more strained. They'll get worse if you do it wrongly. So it's important that you don't do it only by your own self. Please find a right person to train you. Now, let me tell you, being a specialist in this field, there are surgeries available for urine leak. There's something called TVT, tension free vaginal tape, where we below the urine pipe, we put a support, we put a tape like this. You can see the picture. This particular tape holds back the urine pipe, it can raise up the urine support system. And next time when you cough, sneeze, laugh, jump, choke, there will be no leakage. These surgeries were not even available 10 years back so freely. These are highly advanced surgeries, takes only half an hour to do, 1 day stay in hospital, there are no major cuts involved, and you'll be surprised at how beneficial they are that immediately from next day onward you are totally leak free. Yes, it has some recovery time and the details can always be shared based on a case. But these are available. If when I started my medical graduation, these surgeries were not even there. Nobody knew how to treat incontinence, and now after 18 years being in practice, I know that there are solutions. So please ask your doctor, talk to us so that we can help you. And this is the surgery how it is done. There are just two cuts here, and from top to bottom we put this tape, and this supports the urine pipe, and then the leakage is gone. One last thing, small thing, which I really want to discuss is something we call as pelvic organ prolapse. You know, this is something which is so hidden. This is something which it is so difficult to describe for a lady. It is something which a lady is very shy to talk about, but it is right there, especially for women in which there is pre-existing weakness of muscles. Somebody who has delivered children before vaginally, somebody who has got forceps or vaginal vacuum delivery done, someone who delivered children in old times by in houses when they were dais who used to give so much pressure, push, and they will press the stomach from the top so that the baby comes out. Means these kind of damages which may have happened in the pelvic floor in past, when once they happen, for sure at this age they reflect. So this damage will not reflect when you are young because the muscles still have some strength and the hormones were there, but this damage will reflect as you age. And the more you age after 50, 60, once your female hormones have gone down, the estrogens have gone down, the muscles start sagging. So the bladder, the uterus, the vagina, everything starts dropping out, and this is called as prolapse. The incidence is as high as 30% across all age groups. And even if you repair them, the more later you do a surgery, the more chances are there for it to fail. So even in the best hand surgery, 11% will keep coming back. So it's better to identify them early, repair them early so that you can have a problem free life for a long time. How do you know whether you have prolapse? If there is a persistent discomfort at the private part, if there is some dragging sensation which goes towards your back and you feel something is pulling down, something is dropping out like a ping pong ball, it reduces inside like a small lemon size, you push your finger inside and it goes. While when you stand up for long hours, it comes back again. Sometimes it goes in, sometimes it doesn't goes in from below. There's a difficulty in passing urine. Some women says that they have to press that gola, that lump inside so that the urine flows out. They keep getting urine infections. The women will find difficult to control because there is that this small lump sitting and they're not able to squeeze it. They may feel constipated. They feel even motion stuck in that small lump, and they sometimes have to use the finger to hook the motion out. And they're so embarrassed to speak about this that they will go to a clinic, but they will not tell. So, unless I ask and normalize these statements, women will not be able to even speak about it. And let us say if the entire uterus and pelvic organs have come down, they will bleed, there will be ulcerations, there will be infections, and that's where the discomfort starts. So, many times women will not be able to pick it up that yes, she is suffering from prolapse and she keeps all these symptoms to herself. It's always at a later date when things are worse, then they will speak up. Like I said, pregnancy, childbirth, aging, menopause, obesity, and previous surgeries can cause this entire thing to drop down. This is how a prolapse happens. The bladder uterus and the rectum. This is a side view. Now the model which I showed you, this was the front view. And if you see inside, you can see a uterus sitting right there. There will be a bladder sitting in this area, and the rectum is deep behind. Now, same thing if you see from a side, this is how your system will look like. All the organs should be inside, should not be visible anything from here. But if something drops down like this, everything going down, the picture will be like this. So these are the real cases how a prolapse look like, that from below the uterus, the cervix, the part of the uterus, the mouth of uterus has dropped down and almost come out completely, not even going back in. So it's grade 3 and grade 4 prolapse. This is bladder. People who says, oh, we have removed our uterus. I did a hysterectomy long back for whatever reason, fibroids or cysts or anything. But the bladder is still there. So the bladder drops down, like if this is the bladder, it pops up like this. So it will look like a small balloon sitting at the vagina. And once you try to push it, it goes back, and then you are able to pass urine. But then again, when you try to pee, again it comes in front. So they keep on, sort of struggling with the urine problems and flow problems. And when you come for examination, and I see right there that the bladder has everted out, and this is called a cystocele. uh, Treatments of these cases, definitely it's largely surgical. Sometimes we have to remove the uterus, sometimes we have to push the bladder up again and tighten it with the stitches. Many times, patients don't reach to us when they are young. If they're too old, can I still help? Can I do something if the patient is, let us say, not fit for surgery, has a lot of medical conditions, does not want a surgery, just hates to be in OT, doesn't want to see hospital? What to do? Yes, we have something called ring pessaries. So these are silicone rubber rings. These are like soft rings, which are made of medical grade silicone. They can be twisted and put inside the vagina, and they hold up the entire bladder, the entire uterus, and they support at least to some extent. A lot of varieties are available, but we commonly in India use a ring. Once the ring is inside, the whole thing is lifted up. You feel much better. The bladder emptying gets better. The infections get better. Yes, it needs care, and it's not a permanent solution. It needs to be changed every 3 months. But at least it's worth a try for the patients who are not able to do any kind of surgery. And no medicines can fix prolapse. If your muscles have totally gone weak, it's very difficult to restore muscle strength. Exercises, pelvic floor exercises can try to hold it back, will not allow it to worsen, but for sure the cure comes through surgery. So that's why I say that see us early, so that we teach you pelvic floor exercises early on time. We can rectify and do corrective surgeries at a much early age rather than delaying it till 80 when sadly nothing could be done. Thank you very much. So, largely, what I have covered is urinary infections. I have covered incontinence. I have covered pelvic organ prolapse. I've spoken about how to drink right amount of water in right way and not go by misconceptions and myths of over drinking. And definitely, treatments, medications, and surgeries are available. Whenever you feel you're comfortable, please talk to your doctor. Talk to us. Thank you.
Thank you very much, Dr. Saida Nayak, for a very detailed presentation. Uh, Given the nature of the subject that we are doing, we will not reveal the name of the person who's asking the question. So
Yeah.
feel free to ask questions, though, of course, we don't have too much time left. I'll just quickly go through the session questions. And there's a question which is, there's continuously itching, not inside. What is the solution? As I visited the doctor, they gave me an antifungal powder and ointment. This is a lady who's age 66.
Manjulika, I can read the name.
Actually,
Manjulika.
we are not revealing the name. Sorry.
Oh, sorry. Uh, एक ही second, sir. I'm in a call. बैठने बोलो. हाँ. So sorry. Okay. No names. Okay. If the itching is not getting better, then you need to get it checked. Oral tablets are needed, and we may need to do a fungal swab, vaginal fungal swab culture, to make sure that are we giving the right medication or not. Continuously itching, not inside, it is outside. So we need to examine. This case cannot be just given a blanket treatment.
Right.
Yeah.
You have touched on this issue. There's a lady who's 67. She says she's having a burning sensation
Huh.
after passing urine.
Huh. So this sounds like a UTI. Burning sensation after passing urine needs urine routine and urine culture testing. Based on that, you will need antibiotics and urine alkalizers. So you need to see doctor. Yes.
I just want to clarify now,
Mm.
for women above the age of 60, would you recommend that they have, apart from their urine, their regular checkups,
Hmm.
any other routine checks that they should have on an
Oh,
annual?
yeah, yeah. See, as a routine, I always feel whatever age you are, no age is immune to, let us say, infections and cancer. So I generally suggest one sonography in a year for abdomen and pelvis, one urine test, one blood test for your cholesterol and sugars and your CBC. Pap smear, if uterus is still inside, at least once in 2 years is good enough. Till 70, I recommend, though Indian guidelines says after 60 not needed, but I still feel after 60, for few years, once in 2 years, pap smear should be done and mammograms. Still, I will say that I'm a little over out of the way that I overdo things, but I've seen things happening to 60 plus women when they could have been picked early. So if affordability is there, for sure, routine checkup include all these.
Thank you. For those of you who are watching, uh, do remember that this is being recorded and the video will be played, will be available on the Seniors Today website from Monday evening onwards. So if you haven't noted the test that doctors advise, you can always watch it again uh, uh, and and figure things out. We have another question: is surgery the only option for urinary incontinence?
So urinary incontinence, if it is by overactive bladder, overactive bladder means if there is no control while reaching the washroom. If that is the leakage, then medications are available. So overactivity means I need to rush. I cannot hold. I cannot control. Medications will work. But if the leakage is on coughing, sneezing, laughing, the SUI, stress urinary incontinence, somebody has written that also. That cannot go by medications. For that, there is surgery and pelvic floor exercises. So you need to understand which patient has what. Some for some medicine will work, for some surgery will work.
This is a question: do you advise the use of lactic acid for cleaning the private parts?
Say again, you want to use something to clean the private
Yeah,
parts.
LYACTACYD.
Must be lactic acid wash.
Yeah.
No. As urogynecologists and vaginal surgeons, we highly discourage any kind of chemical agents to clean below. How so much fancy the pharma industry says, how so much fancy the word sound and the preparation looks on the medical stores. Answer is no. Vagina after 60 years is very sensitive, very dry. If you use these washes, it washes away all the lactobacilli, which are healthy bacteria. Answer is no. Please use plain water and just soap externally, not internally.
You. This is somebody who says she feels weakness after urination. Is there
Hmm.
something to worry about?
Weakness after urination.
That's right.
See, scientifically, there is nothing like that. Why should somebody feel weak after urination? But it's a very common symptoms in diabetes. Diabetic patients, once they pee, they suddenly feel very drained. They suddenly sweat. They suddenly, sometimes they get fainting kind of thing. So this is a symptom which needs more evaluation. And urinary infection needs to be ruled out. So this patient needs to talk to us.
Right.
Yeah.
There's a lady who's asked this question. She's 67. मैं जब कहीं जाती हूँ 4-5 घंटे के लिए विदाउट गोइंग टू द वॉशरूम रह सकती हूँ, पर
हाँ.
जैसे ही घर वापस आती हूँ तो
Hmm.
बिल्कुल कंट्रोल नहीं कर सकती. कभी कभी तो वॉशरूम पहुंचने के तक यूरिन पास हो जाती है. इज
हाँ.
दिस प्रॉब्लम?
इट विल बी अ प्रॉब्लम इफ यू ट्राई टू होल्ड फॉर लॉन्ग आवर्स. अगर आप बहुत लंबा होल्ड करने की कोशिश करेंगे तो लीकेज वर्सन होगी. आपके केस में बेस्ट ये है कि आप घर से निकलने से पहले वॉशरूम जाइए, बाहर लिक्विड्स का इंटेक मिनिमम रखिए और वापस आते ही पहले वॉशरूम जाइए. डू नॉट होल्ड योर यूरिन फॉर मोर देन 3 आवर्स इन एनी केस. इट साउंड्स कि आपका पेल्विक फ्लोर वीक है.
राइट. There's a lady who said, I'm 74, suffer from UTI frequently. Please tell me the reason, precautions, and treatment.
74 frequent UTIs. I need to see you, मैम. मैं बिना देखे ना आपको पकड़ नहीं पाऊंगी कि what exactly is the reason of your UTI. If it is only dryness, then the Primarin cream which I mentioned will help you. And sometimes at this age, the outlet of the urine pipe shrinks. So there is always a high urine in the bladder retention. There's residual urine, and that's why you're getting infected again and again. You need one sonography to make sure that you are not retaining urine. If there is no retention, medicine will help. If there is retention, you will need cystoscopy and dilatation of the urine pipe. So I would rather, if possible, I would like to connect with you.
There are two more questions we'll take, doctor. This is from a lady who says, Doctor, we are advised to drink a glass of water before sleeping to avoid attacks and strokes.
No, that
Uh, but this makes me urinate
yeah.
often. What
Yeah,
would you
that's a myth.
advise?
That's a myth. For if stroke was happening that way, then all those people who do fasting for long hours, they all will die with stroke. So it is definitely a myth. Better stop drinking right at the bedtime. Whatever you want to drink, drink in whole day. If I have given you 2 liters in a day, and I ask you to finish it 1 hour before your bedtime, your body is already well hydrated. In the night, even if you don't drink anything, your body is going to make 50 ml per hour urine, which is normal. So even if we don't drink in the morning, we all go and pee. So that means your body is capable enough. And if you drink, your bladder will not be able to handle. Stroke, whether prevented or no, nobody knows. But definitely you will wake up 3 times, and if there is a fall risk, you will end up, having fall in washroom. So please, that's a myth. Okay.
Thank you very much, Doctor, for an amazing presentation. Thank you. We've answered quite a few questions, and your presentation is very detailed. To all of you here, remember that this presentation, this entire session, is being recorded and will be up on the Seniors Today website, along with takeaways written by a qualified medical practitioner. So do watch the Seniors Today website, do access the Seniors Today website on Monday evening, and we will be there with the takeaways. Thank you very much, Dr. Sarita Nayak, for being here.
Thank
And we will be back again next Saturday at 5 p.m. with another session of health webinar. That session that we are having next week, I must mention here, is on diabetic neuropathy. Diabetic neuropathy is a session that we are having on next week. So do come in and watch that. And thank you very much again. Doctor, we've had quite a few people here, 150 people attending it, a little lesser than normal because I guess the subject is a little specialized, but around 1,000 odd people who are watching us on YouTube live. So it just shows the interest level that is there. And I'm sure once people do watch your presentation, it will also be circulated a fair bit. Thank you very much once again. Thank you.
Thank you very